Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And we're at the HIMSS 2022 conference, and we're with Ann Santafurst. She's executive director at Share. Welcome, Ann.
Thank you for having me. This is exciting.
Yeah, I'm excited to learn about you. You're doing some incredible stuff with your HIE in Arkansas. So tell us about the statewide HIE collaborative, but also with ADT notifications that you shared recently at the presentation at HIMSS.
Yeah, so we came to HIMSS to talk to folks about how we can use HIE data to improve quality and improve patient experience and provider experience when it comes to, submitting documentation for, say, payers or to the public health office and things like that. So we try to automate a lot of those functions to remove that barrier from the provider from having to submit paper records to different entities.
Yeah, and like every HIE, you have to have lots of partnerships, and you have a long-standing partnership with Secure Exchange Solutions. Tell us about how you work together and the impact that relationship's had on your end users.
Yeah, so we've been working with SES for a few years now, and our relationship actually began with a payer who had a need. So we have great relationships with the payers in Arkansas. They all contribute and participate and contribute to the HIE, but payers are very unique. They want things very specific ways, right? So one problem we were trying to solve was risk adjustment.
Okay.
So if you're in a Medicare Advantage plan, sometimes your payer will ask for your charts, so then they can make sure that you're properly coded for risk adjustment.
Okay.
And a lot of times those elements don't translate over to claims, but that information is contained in clinical data like HIE data. So we had a payer who wanted to do risk adjustment and automate a lot of those functions, but they wanted it in a very specific way. They basically wanted me to take some clinical data and make it look like a paper chart so their risk adjusters could just do their work just like they're doing without any interruption, right?
Uh-huh.
So we tried many different ways to please that payer and tried different methods. We weren't being successful, and SES came to us and said, hey, we have this tool, we have this other payer that we're working with. We think we can really provide that payer with a lot of those risk adjustment charts that they have. So this began our relationship, and it's been going pretty great. HIEs try to do a lot of analytic stuff, and we can be successful sometimes, but we can't be successful at everything. So in this situation, SES had a product that was already built that was going to work for that payer, and we had the data. So we took a step back from analytics and we feed the raw data back to SES. They package it up in a nice, pretty report, just like the payer wants, so then they can do those risk adjustments electronically and let the provider take care of people and not say, hey, give me those charts.
Yeah, well, and I think it's interesting because as an HIE, you don't want to be a tech company. You want to deal with the relationships, and that's an important part of what you do, and so it sounds like that's what you did. I know something else you do that's really interesting and impactful is the real-time alerting. And so I know you did a public-private partnership for that, so tell us about what you did there to really make that a reality.
Yeah, so this is a cool model where we have payers that participate in the HIE, and they want to get information on their members, all in real time to their analytics platform. Well, we recognized early on that we could leverage that list to go a step above. So we take the payer attribution list and we actually create targeted reports back to the providers based on that patient-provider relationship that we get from the payers, right? So now providers in Arkansas get daily reports on events that's happening with their patients in almost real time, and they don't have to submit anything to us. So that we get that information directly from the payer, who's the source of truth, who decides that patient-provider relationship, and then we create targeted reports to them. And they love it because they don't have to submit anything to the HIE. They just reap the benefits. And payers are a lot more sophisticated. They have IT, they have infrastructure, they have analytics, and a lot of our small rural providers in Arkansas just don't have that. You have your office manager who is the wife of the doctor, who is, the nurse. She does not have time to deal with IT. It's above her. That's too much. So we get that information directly from the payers. We leverage it, and then we help the providers.
I love how you make it simple for them. But I think the other challenge that I see, you talk about working with multiple payers and providers across the entire state, which it's great that you're the only HIE in that state, right? But don't you have problems with patient matching? Like how do you address that, and what technologies are you using to deal with patient matching? Since we don't have a national patient identifier, although we'd still have problems even if we had that.
We would. Yeah, so having a good patient matching tool is definitely key to success, right? So we get about 10 million messages every month from the different providers that are connected to the HIE. So every single one of those messages has to run through our master patient index, so then we can attribute that right back to that aggregate record of that patient. So yes, patient matching, it's still not perfect, but we're working towards it. It's funny because the person with the most influence in a provider's office is that clerk that registers the patient. So one mistake, one transposed number, it can really derail the whole message and end up airing it out and needing human intervention. So we're still working on patient matching, but it's better, and having a tool to help us with that, it's really improved.
Yeah. It's an ongoing thing. I mean, as someone named John, I understand the issue, so that's interesting. So let's talk about some of the challenges that you see, like your payer customers experiencing in terms of being able to really leverage the breadth of data that you have in the shared network. I mean, you have such a good, depth of data that's available to them. And how have you worked with Secure Exchange Solutions to really address those challenges?
Yeah, so like I said earlier, the formatting is very important to payers. And payers are at different levels of engagement with HIEs, with technology, right? They want to work with technology, and some of our payers in Arkansas have recognized that early on. And said, this data is really important for me to be successful with my risk adjustment, with my HEDIS reporting, with my provider notification to reduce that readmission and improve that quality of care of that patient. So they're at all different levels, and some are better than the others.
Some have legacy systems, but they still want to dictate to you what they want.
And that's where we really struggle working with them. It's, do we build 7 different analytics platforms to appease 7 different payers, or do we just take a step back and let them use whatever tool of their choice, and instead we feed them the raw data to their analytics platforms? And so there's some really cool use cases going out. We have payers who have automated prior authorization that actually work with SES, and they do prior authorization electronically. They get that message in real time. The nurse gets an alert and a task to start working on that case, and they really are able to do a lot of it electronically without ever getting to pick up the phone, having to pick up the phone, or make requests for paper charts.
Yeah, I mean, I think we all want to solve the prior auth problem, so that's a good step forward.
Well, it improves our patient experience too, right? Because if that can be done automatically, then it's less time for me.
Yeah, and in value-based care world, if you can approve something that really needs to be done quicker, then it improves the quality of the care as well.
Yeah, and saves us money. Yeah. Saves Medicaid and the payers money.
Do they call that the quadruple aim?
I think so.
Something like that. So where do you see the greatest area of growth for HIEs in the future?
Everybody wants to work on social determinants of health. That's the hot topic,
I've heard a lot about it.
So, the problem with social determinants of health is when you screen somebody for it, you better have a resource to connect them to, right? You can't say, are you having food insecurity, and just mark it on their chart.
They have food insecurity. I'm responsible, but I can't help you.
Yeah, I'm sorry. So working with those social determinants of health providers and those who screen for social determinants of health, and then capturing like where they got referred to, what are they struggling with? Is it housing? Is it transportation? Is it food? Is it health? Is it mental health? So we are working towards gathering more social determinants of health data so we can share back with the payers who could potentially have interventions and ideas.
Sure.
Even Medicaid. Medicaid does food stamps, and they do a lot of other social services. So how can we empower Medicaid with that information so they can provide early intervention? We're not going to solve all the world's problems, but at least we're making people aware that there's potentially a problem here that needs to be addressed.
Yeah, it's a hard problem to solve, but it sounds like you're wading in the right way to understand the problem, which is the first step, and then try to connect it to the right solutions.
Yeah.
Well, thanks so much, Ann. This was a really interesting conversation. Thanks for sharing all your perspectives and your experience, and thanks everyone for watching. If you want to find more great health IT content like this, be sure to check it out at healthcareittoday.com and search for Healthcare IT Today on your favorite podcasting application.